Welcome, medical residents, to this informational video on acute leukemia. Today, we'll explore the differences between acute myeloid leukemia, AML, and acute lymphoblastic leukemia, ALL, their presentations, and causes of early mortality. We will also touch upon initial induction chemotherapy. Let's dive in. Acute leukemia is a rapidly progressing cancer of the blood and bone marrow. It is characterized by the uncontrolled growth of immature blood cells, known as blasts. Two primary types of acute leukemia are acute myeloid leukemia, AML, and acute lymphoblastic leukemia, ALL. The main difference between AML and ALL lies in the affected cell type. AML involves myeloid cells, which include red blood cells, platelets, and neutrophils, monocytes and macrophages. On the other hand, ALL affects lymphoid cells, which are responsible for producing B cells and T cells. The presentation of acute leukemia can vary, but common symptoms include persistent fatigue, unexplained weight loss, frequent infections, and easy bruising or bleeding. Patients may also have bone pain and enlarged lymph nodes. Unfortunately, acute leukemia can lead to early mortality from several complications. Let's explore some of these causes. DIC is a serious condition where the body's blood clotting mechanism becomes overactive, leading to widespread clot formation in small blood vessels. This can result in organ damage and bleeding. Patients will show mucosal bleeding and labs will show abnormal coagulation studies and a fibrinogen less than 100. Give cryoprecipitate, which is rich in fibrin products, for a goal fibrinogen over 150 and check labs frequently. Acute promyelocytic leukemia is a subtype of AML that commonly presents with DIC. This condition can be identified by seeing Auer rods on the peripheral smear or 1517 chromosome translocation. Give all trans-retinoic acid as soon as APML is suspected, even if you aren't sure. TLS occurs when a large number of leukemia cells are destroyed rapidly, releasing their contents into the bloodstream. Spontaneous TLS occurs when cells divide more rapidly than the body can handle or if there is a lot of DNA errors that make these cells more fragile or short-lived. TLS can lead to metabolic imbalances, including high levels of uric acid, potassium, and phosphates, which can lead to an AKI or even cardiac arrest. Treat with aggressive fluid resuscitation and drugs to lower uric acid levels. Neutropenic fever is a potentially life-threatening complication of leukemia treatment. Chemotherapy can suppress the production of white blood cells, specifically neutrophils, leaving patients susceptible to severe infections, but sometimes leukemic cells can completely replace the normal functioning bone marrow and cause neutropenia. While leukemic cells are white blood cells, they functionally are useless and do not contribute to a normal immune system. Leukostasis occurs when an excessive number of leukemia cells accumulate in the blood, leading to blockages in small blood vessels. This can impair blood flow and damage organs. Leukostasis can occur when the white blood cell count exceeds 100,000 with predominantly blasts. This condition can be treated with hydroxyurea or leukapheresis at some specialty medical centers, though no difference in mortality has been found between these two treatment approaches. To combat acute leukemia, initial induction chemotherapy is used to achieve remission. This involves administering powerful anti-cancer medications to destroy the leukemia cells and allow healthy blood cells to regenerate. In general, AML is treated with an induction regimen called 7+3. Additional drugs called midostaurin or gemtozumab oxaligamicin may be added with specific mutations or cytogenetic risk profiles. ALL treatment is more complicated based on age, B-cell or T-cell lineage, and if B-cell ALL, if the Philadelphia chromosome is present. Induction chemotherapy is very intense and can be tough for patients to handle. Once induction chemotherapy is completed, patients are hopefully in remission and then start on another slightly gentler but longer phase of treatment called consolidation. After consolidation, many patients with leukemia will require an allogenic bone marrow transplant. In conclusion, acute leukemia is a serious condition that requires prompt diagnosis and treatment. Understanding the differences between AML and ALL, recognizing the presentations, and being aware of the causes of early mortality are crucial for medical residents like you.